Are you ready?
Mm-hmm.
Okay, let's go. Hi, I'm Emily McCrystal, and this is The New Mind. Today's guest is a bit different to anything we've had so far, actually. But as you know, with this podcast, it's all about the story. And really, it doesn't matter who you are or where you're from, everyone has a story. And a lot of the listeners I know are people with children. And I think this is really important subject to cover in terms of mental health, actually, because as a psychotherapist, I have so many women and men that have had children that struggle with various aspects, especially in the early years of being parents, but also navigating their way through the difficulties that can arise from having children. So today's guest is Emily Whalley. Now, Emily is a sleep coach, holistic sleep coach, and infant feeding coach. So, really important areas actually for us to talk about. But also, Emily has a story. And I think a lot of you are going to connect with the story because so many of you will have gone through similar things that perhaps you haven't spoken about to anybody. And if you have, it will be a select few. So, my hope is that those of you listening will get a real insight into not only the business that Emily's in, but also into Emily herself. Welcome, Emily.
Thank you. Thank you for having me.
No, you're very welcome, because we spoke on the phone briefly and we've spoken today, and I know that there's a lot that you've gone through that drove you into doing the work that you're doing, really.
Yeah.
And I kind of just asked you a minute ago where to start, and you said start with the second child, actually, but then you said actually with the first there was quite a big thing that happened in your life. So I think, first of all, tell me a bit about you before children, just so we can get an idea of who you are, and then we'll go into the story.
That's a really good question, because I was thinking a little bit about this morning, actually, because so much, when you do become a parent, everything you do is for and about your children, and you lose your identity a little bit. But I think that I was just floating through life. Like I was really passionate about media and film, and I love to act, and I did a degree in that and did some acting for a little bit. And then,
wow, I did not know this.
Yeah. And then realized there was, you had to do a lot for free in that industry, and I couldn't afford to do that. So, but behind everything I've ever done, my mum will say, from being 3, I would pretend to breastfeed dolls I had while she was breastfeeding my brother. And
wow,
it was, I want and need to be a mother. And that was my biggest kind of drive and focus. And it's becoming that has changed who I am. And I wouldn't say that it's what I thought it would be either. And I'm sure we'll talk about that. But before children, like everybody, there was a lot of kind of things that happened in my childhood and in my teenage years and things that I think shaped who I was. But when I think back to becoming a mother, I didn't know who I was at that point.
Yeah. So what were the kind of, before you had kids, because I know this is the same for all of us, including me, you have no idea. You think you know how motherhood's going to be. You think you know what kind of mother you're going to be. And actually, wow. It's really hard.
Yeah.
I mean, I think I've scared quite a few of my friends when they've had children, because I've been like, look, remember, and I probably have said the wrong thing. Remember, your friends are going to tell you how amazing it is and how wonderful it is and how easy it is. That was not the case for me personally. I struggled a lot myself in the early years. Mine's nearly 16 now, so it's not so difficult. But there's different challenges actually with teenagers. But I found it really, really hard.
Yeah.
And it's one of the reasons that when we were speaking, I thought this is ideal, because I know that a lot of women find it really hard and almost ashamed.
And we're still not talking about how hard it is.
No, we're not.
And when we're just pretending, or kind of only showing people what we want them to see, but we're only going to find that common ground with people and help each other if we're honest about how hard it is. And it's shit sometimes.
Yes.
And that's such an important thing to say. You wouldn't change your children for the world. You wouldn't go, actually, this life is not for me. I'll send them back. Not that you could do that. But there'll be times when you think that. You'll be like, please, God, somebody take this child from me just for a minute. And that's reality. We're still not talking enough about that.
No.
And had I had people in my life telling me, I mean, the only person that ever said to me was my stepdad, actually. He said, they ruin your life in the best possible way, but your life will never be the same. And I was like, I don't care. That's what I want. Like, I wouldn't have listened, maybe. But there's been so many surprises. And I wouldn't say that my motherhood journey has been smooth. We've had a lot to contend with. And I think that I've learned a lot about how my brain works since having children. And,
Yeah.
there's been a lot of self-discovery since having the boys. But yeah, it's not been full of rainbows.
No, it hasn't. No, it really hasn't. And I think, again, I know that you probably talk a lot about it to some of your clients or whatever, but I think this is really important because I'm going to be a little bit open as well. And I think it's not to put people off, because I wouldn't change it for the world. Like, literally, my daughter has been the greatest thing that's ever happened to me.
Mm-hmm.
But it is, I do get fed up with hearing about how wonderful it is to be a mother, because
Yeah.
it's not always, actually. There's nothing to do with the child.
No.
It's to do with your own experiences prior and the things that you encounter during pregnancy and after pregnancy.
Yeah.
Which leads us neatly to you.
Mm-hmm.
So you've got 2 children,
Mm-hmm.
2 sons.
Mm-hmm.
And when did you have your first child?
In 2015.
Okay. Talk to me a little bit about, well, first of all, the pregnancy, the experience, and then what happened when you had your first child.
So the pregnancy, finding out I was pregnant with Arthur, was amazing. I am the type of person that has to have control over a situation, and I've learned more recently about why that is. But the pregnancy was good. I think I was 42 weeks pregnant and the size of a small house.
Did you say 42 weeks?
Yeah, and there was still no baby.
Wow.
And I actually started to think, I'm not pregnant. Imagine this. It's not happening. This baby's not. It's just, when is this going to happen? And I'm a researcher. I need to know everything about anything. And that's why my job is so important to me and why I'm talking about the things that I do within the job that I'm doing. But I did hypnobirthing course. I learned everything there was to know, but I did not prepare for the things that might go wrong.
Yeah.
And I think there's a lot, we could be here for hours, but there's so much to say about kind of birth choices and, what you're entitled to, having a voice during labor and delivery. And ultimately, I was induced against everything I'd said kind of throughout the pregnancy. I'm not going to be induced. I'm going to ask for this. I'm going to do this. And I think I was in labor for a long time, it must have been 48 hours. And I felt very out of control, felt like my body was telling me something and I was ignoring it, and that people were telling me what my body was doing. And ultimately that led me to not trust myself and my body, because I was so vulnerable. And yes, I was 25. That's quite a young age to have children, depending on, where you are in your life or who, how you feel. But I felt so ready for it. But ultimately it led to an emergency C-section. The C-section itself was fine, but my brain had not prepared for that or expected that. That was not happening to me because I'd done hypnobirthing.
Yeah.
And for a while I wanted to burn every hypnobirthing book I ever saw, and I was so angry.
Yeah.
But Arthur was born, and it was like somebody had run me over. Not only because I'd gone through all of that, I'd been awake for 4 or 5 days.
Which in itself is torture.
Yeah, exactly. And everybody was saying, you'll be fine when you get home. And I remember being in the hospital, and it was the height of summer, and there was a door repeatedly slamming next to the hospital bed. And it was that noise, that repetitive noise, that kind of sent me in. I felt like I was losing my mind.
I bet.
And it was mostly sleep deprivation. But then getting Arthur home was just, I remember looking out of my bedroom window when I got home at a couple eating dinner, and if they saw me, I bet they were like, what is she doing? But I remember thinking, I'll never do that again. I'll never sit and eat a meal
Yeah.
at a table. Oh my God, what have I done?
You sort
Like,
of felt completely overwhelmed by
yeah,
this whole
yeah,
life that you had ahead of you now.
yeah. And I couldn't, he wasn't feeding. I was desperate to breastfeed, didn't even entertain formula feeding or bottle feeding him. And breastfeeding was agonizing.
Hell.
Yeah. And I
I had that
remember,
experience.
you know, knowing what I know now, I know why.
Yeah.
And this is the whole kind of story, is that if there was just more knowledge and support, things would have been
Yes.
different, and it would have saved my mental health.
Yeah.
But it got to the point where I'd not moved out of a chair for 3 days, and my mum and my partner, who he was at the time, kind of said, enough's enough. We have to feed this baby, and you have to get some sleep, because this is not good. And I didn't know what I was experiencing with psychosis until I became pregnant with my second son and self-referred to a psychiatrist who diagnosed that. But at the time, every time I went to sleep, I'd be woken with this kind of intense fear that he was dead.
Yeah.
And there was nothing anyone could tell me, like, he's fine. I'd be like, no, he's dead.
Yeah.
And I'd see him and he'd be blue, and it was horrendous.
So you were hallucinating.
Yeah, and it was sleep deprivation induced, probably.
Yeah, yeah.
But had I been listened to and heard, and, you know, throughout the birthing process, you know, would it have been a different outcome if I'd have had the right feeding support in hospital? If, you know,
Yeah.
I do think about that a lot. And I
Yeah.
did for a long time think I'd love to just go and be able to sit with these women that have just had babies and be like, in a few days, you may feel like the world is going to end. And that's okay. It's normal. It's not going to end, and you'll be fine. But what about if you don't ever recover from feeling like the world's going to end? And I don't think I did for a good 9 months. I was
Which
very,
is a
very depressed.
really long time.
Yeah.
Really long time. I mean, 9 months, when you say that, people just go, oh yeah, that's bad. But when you're living that day to day, of feeling the way you were feeling, hallucinating, sleep deprived, thinking that the whole world is never going to be the same again, that's a long time.
It is. And it would start to manifest in things like I wouldn't leave the house if I knew he was going to be tired, or he'd need a feed, or the only way I could control my life at that moment was to control his. But that babies can't be controlled.
No.
But that's so if anything wasn't to go to the plan that I'd set, it was my fault, and there was something wrong with my baby. And that's not the case at all. And I know that a lot of people be like, yeah, I totally understand that.
Yeah.
But that's how I lived my life. So I was just desperate for some form of control, and I was in fight or flight. I think potentially I probably still am in some ways, but it was constant fight or flight all day, every day. That's how I got through.
Yeah.
And it changed. Like, I have a very close family, very close friends. I'm very honest about my mental health, and I'm also very aware of my own brain and what triggers me. So I was really able to communicate with people how I was feeling and why, and that helped them understand that. And I know I see it as a good thing, but it's also quite negative for me sometimes as well, because I'll be having these kind of thought processes and not know how to break out of them and things. But things did get better. You know, Arthur was quite a poorly baby. He had bronchiolitis on his first Christmas. We were in Christmas on Christmas Eve until New Year's Eve for his first Christmas. That was very traumatic.
You're in hospital.
Yeah.
So he had to stay over for
10 days. Yeah. And he was on oxygen. It was just, and Christmas is my favorite time of year. And I was like, this is going to be the best Christmas ever. And we're going to do this. And then again, it was like just another layer of that trauma, and that set me back a lot. But when I'd actually said, I don't think I could do this again. But then part of my brain was saying, it won't be the same, and you can make it not the same. You know now what can go wrong, and if that happens again, you're prepared for it, and there's a way of you having some control over that. So we decided when Arthur was about three and a half, no, about 3, that we would consider having another baby. And I got some help. I started some therapy, and we fell pregnant really quickly. and I self-referred to my perinatal psychiatric team. Again, I think that's something that people would be scared to do. Like it's a label, but I knew that if I didn't have that support, I wouldn't have this family that I wanted to have. And part of me wanted the second baby to heal and to prove to myself that it wasn't going to be the same.
Yeah.
And you couldn't write what happened next, but it's taught me an awful lot of things about, but mostly it's taught me how much needs to change.
Yes.
In society and within our healthcare system. And, and that's what's kind of driven me into the job role that I do as well. But, Henry taught me that nothing is going to ever go to plan.
So to recap, first baby, you were so like, this is going to be the best thing that's ever happened. I'm born to be a mother. I've been practicing this with my dolls for as long as I can remember. Mm-hmm. Arthur comes along after a arduous and difficult birth, and you have a C-section, which leads to a little bit of postnatal depression. I say a little bit, a lot. Mm-hmm. Postnatal depression, and then psychosis, where you're experiencing all sorts of mental health issues, including hallucinations, which would have been really, really scary.
Yeah.
By 3 years, we're ready to do this again. I've got this. I know what I'm doing. Mm-hmm. So tell me about the second experience.
So again, pregnancy was okay. I had a lot of sickness, and convinced myself this time it was a girl because of how sick I was. You do that a lot, don't you?
Yeah.
Like analyze every symptom. I felt good. I felt in control. I had a brilliant obstetric team that were on board with my psychiatrist plan that I was going to have a planned cesarean section on a date that I'd be told way in advance to help me. Like, okay, that's what's happening.
Yeah.
Things like they'd made sure kind of around 22 weeks pregnant, they said you're going to have your own room. So they'll, sleep will be prioritized. Like, this is going to be in your notes. Like, we know sleep's a trigger, and lack of sleep, and you don't sleep when you have a baby. And I just felt really empowered and listened to for the first time probably ever in my life, I think. And I was feeling really good. And then 29 weeks pregnant, I woke up and my waters had gone.
Oh my God. So 42 the last time.
Yes.
29 this time.
So there was no, if you've had a baby that was overdue and then they've had to be coaxed out, you've had to be induced, you're told your second baby is probably going to go the same way. I don't know how much that is evidence-based, but I was in utter shock. Like, I thought it was blood, when you wake, I was like, oh my gosh.
Because your water's breaking for those that haven't had a baby. It feels really strange, doesn't it?
Yes. And I knew instantly from the sensation that it was my waters, even though I'd not experienced that with my first child. Like, my waters were broken
for
manually.
you. Yeah.
And my husband was on nights, and it was just a very strange set of things that happened. Like, I got out of bed, I put the light on and went and sat on the toilet, and immediately grabbed my phone and called triage at the local hospital. And as I'm ringing, I hear my husband's key in the door. I didn't even check the time, but he'd obviously finished work and come home. And I heard the door opening, and then he said that he just heard me on the phone. But his initial reaction was to just start clearing up the water. Oh. He was just like, what can I do? I'm just going to start cleaning. And I was like, I'm sat on the toilet having a nervous breakdown.
He's cleaning away. Yeah. He's got the old flash out with him.
Yeah. And triage just said, you need to call an ambulance and come. And I said, I can't get in an ambulance. I've got my 3-year-old in bed. They just said, can you take him somewhere and come down? And what followed was a 2-week stay in hospital, trying to keep Henry in. Steroids, magnesium drips. That is a whole experience in itself. Like, it's a very strange experience. But immediately was back to that place. Nobody's listening to me.
Yeah.
I was having contractions the whole 2 weeks.
Oh,
and
God.
I was simply told that isn't possible. And I was saying,
I love it when they say that.
And I was saying, okay, that's fine, but I am.
Yeah.
I was given Buscopan, told it was, I was having bowel spasms. It was an IBS. It was an IBS thing, and I was like, no, this is happening.
Yeah.
And they only kind of intensified. And they said, would you be up for delivering naturally if this happens? So I said, yeah, I'll give it a go. And then they scanned me and said that Henry was breech. And it got to the point where every day I was saying, I'm having contractions. And then they'd ease off and everybody like, oh, she's on it again. She's saying it again. And I remember the night before Henry was born, I rang my husband and I said, I am in labour. Like, there is no denying this now. These are contractions. And I just remember losing my temper and saying, you need to listen to me. This baby's coming. I got taken to delivery. The obstetric team that were looking after me were in an emergency. And I was left to contract. And with a premature baby, no pain relief until the script that, I've since had all my notes back and kind of read. I needed to know exactly what happened in what order. And the notes say that I was in such distress that somebody had come out of theatre to check me, and I was 10 centimetres and Henry's feet were coming.
Oh my gosh.
So I was rushed into theatre. They prepared me for an emergency section with a spinal, but then I was just saying he's coming now.
Yeah.
So I was intubated, awake, and put under a general anaesthetic, and he was born within a minute and a half of knife to skin. And he was born unresponsive. Obviously, I was under general, so I didn't know any of this. And it was very apparently, very quickly, that there was something very wrong with him.
Oh my life.
Yeah. And nothing was really communicated to my husband, and he just saw Henry and kind of thought, I don't know if this is a premature thing, but he doesn't look right. He doesn't look okay. And none of the doctors had seen a baby looking like Henry before. And he was taken to neonatal intensive care. And then I met him maybe 16, 17 hours later.
Wow.
And I knew as soon as I saw him that he wasn't okay. And that was hard.
Yeah, I'm sure. I mean, I can't even begin to imagine, actually, because that's just your worst nightmare. So those first, this is trauma all over it from beginning to end. And after going through such a difficult time with you first,
Yeah.
and I can see you're really upset. So if you want to stop at any time, we can stop. But then to go through that, and the fact that it's so, upsetting still. How old's Henry?
He's just turned 4.
So this is 4 years ago, and it's still raw, and it's still something that I know you talk about a lot. Like your work is your life, isn't it? And so important to you because you didn't have anyone listening to you.
Yeah.
And this is after your first child as well, where you did know a bit more, and you can almost understand it if it's someone's first, because they really don't know what to expect. But this was your second, and you weren't listened to.
No.
And I know some amazing midwives, by the way, but I know the system itself is broken.
It's never the individual, really. It's I think a lack of. I wish I had the answer there. People asking me this a lot because there's so many things that happened with Henry, since he's been born, that I talk about a lot and help other parents with. And parents will say to me, why is this not mainstream, or why? And one dad once said to me, it's a lack of curiosity.
Yeah.
And it is. That hit the nail on that.
Well, I also think this because you sharing a bit about your story, and we're going to come back to it because I know there's a lot more to hear, but I had actually quite an easy pregnancy and an easy birth. I had planned a home birth, and at the time there was no home birth unit in Northampton, and on the night of my birth there was no midwives available, so I did all of it on my own until the last 2 hours, where I had to go to hospital.
Yeah.
And paramedics turned up. They gave me gas and air, which I told them I didn't want. I projectile vomited, put my back out. So I was now in a lot of pain. And I had actually, interestingly enough, no one on the planet Earth had told me that you can contract continuously.
Mm-hmm.
So I was expecting a nice 20 minutes in between, have a
Yeah.
sandwich, have a bath, watch a bit of EastEnders.
Yeah.
Why not?
Mhm.
Sounds amazing. Truth is, waters broke 24/7. It was well, actually it wasn't 24.
Relentless.
Yeah, it was relentless.
Mm.
The contractions did not stop. There was no gap,
Mm-hmm.
and it was all in my back.
Oh,
And I
God.
couldn't walk.
Yeah.
I didn't go for a wee. I didn't do
Mhm.
anything. Actually, tell a lie. After the waters broke, I did go for a wee, but then from there, I was stuck on the bed. I couldn't move. I couldn't walk,
Mhm.
and I was scared out of my mind because I was like, "This is not what I've learned."
No.
Again, it's a bit like you.
Yeah.
Nowhere near what you've been through, but I was still scared.
No, and I say that people will listen to my story and think, "Oh my gosh, well, I didn't go through that. Maybe I shouldn't feel as bad. Maybe I shouldn't." It's all trauma's relative. Like there's
Yeah.
I'm not entitled to feel anything more than anyone else. And my best friend in the whole world had an amazing home birth with her second child, and she was so low
Yeah.
after and didn't want to tell me because she thought that I'd be like, well, you've not lived what I've just lived.
It's
And
interesting, isn't it?
yeah, and they were born 4 weeks apart. So as we were being discharged from NICU, my best friend was having her baby. And because of how much I know her and how close our relationship is, I knew that she was struggling. And I said to her, it's fine. You can feel it. Your feelings are never wrong. Like your
Well, you
emotions
can't
are never,
help it.
exactly. They're not any less or more valid than anybody else's.
Yeah.
And interestingly, considering what we went through with Henry, my mental health was nowhere near as bad as it was with Arthur. But it was a whole...
It was a different type of reaction, I'd imagine.
Yeah. It was... I mean, this sounds awful, but the recovery was better because I was sleeping.
Yeah.
Because, yes, I was pumping breast milk every 2 hours and running it down to intensive care whilst I was still an inpatient. But then when I got home, I didn't have a baby to look after,
Yeah.
which is awful. But I only recovered physically a lot better.
Why is it awful though? It's interesting that you say that.
Because I think that might have saved my mental health. Getting sleep may have saved me. And actually coming home from the NICU, I did have this period of time where I was not okay. But everybody was so hyper vigilant to my mental health when Henry was born. Like my parents and my friends and the healthcare professionals, they were all... I could see everybody just like, when is she going to go? When is she going to tip?
So you got more support because of that.
Yeah, because I was honest about how I felt the first time.
Yeah. That's a key. That's why I say, why is it awful? I kind of wanted to say, because I've said this a lot when I've told bits of nothing as severe as that, but bits and bobs of... I remember saying to someone about my daughter didn't sleep very well at all. She wouldn't go to a cot, she wouldn't go to a crib, she wouldn't go to a Moses basket, she wouldn't be handed to anybody else. She was very, very about me. And I remember one night where she had some sort of, I don't know if it was tummy ache or whatever, and she wouldn't shut up. And I remember there was a moment holding her and I wanted to throw her against the wall, and I really genuinely wanted to throw her against the wall. And I used to say to people, I know it sounds awful, and now I don't do that in case they've experienced that feeling.
Yeah, I think I'm saying, I know that sounds awful, because I think I feel almost a little bit guilty that the reason I didn't struggle mentally is because I was leaving my newborn in hospital every night, and maybe that's like I don't know, but if it hadn't have been for Arthur, I probably would have stayed with him and but regardless of that, it saved me. I don't know what part of it, but I was a lot better. But it's being in NICU and getting a call at 3 a.m. saying because they would never... You'd ring to check and say, how is he? And they'd never say he's fine, because they can't.
Right.
They'd say he's lovely. And if he had been poorly in the night, they'd say he's been a bit naughty.
Yeah.
And I knew to pick up on different languages. So like getting a call at 3 a.m. to say, Hemi's being a little bit naughty, we need you to come down.
Right.
Or, whatever had happened. But yeah, you'd learn to pick up on different languages, different words that they would use and what they meant while I was there. But yeah, you're right. I think nobody's had that moment where the child has screamed for 24 hours and you've not wanted to do something drastic.
Yeah.
And
it's you feel ashamed to say it at first, but it's why I said it a lot, because I thought, well, I wouldn't want anyone to experience that and think they were the only one. So if they know that a therapist has had that experience, then they might just go, okay, it's okay for me to say to someone, this is how I feel, because it's likely that if
Yeah.
a therapist has experienced it,
Yeah.
and also I'll say, I've worked with hundreds of women that have had that experience. So I can say, this is a normal reaction to not having any sleep, to also being completely physically and mentally exhausted in every single way. Doesn't mean you're a bad person. It doesn't mean you're a psychopath.
And I think that every mother on this planet has said, go the fuck to sleep.
Yeah.
At some point.
Yeah.
Screamed it even.
Yeah.
And you don't feel good about it.
No.
But I say this a lot to my clients, like, you don't become a parent and then not be a human being anymore.
Yeah.
You're still going to have all of those anger, you're still going to experience every normal human emotion.
Yeah.
But because we're parents, we feel like we have to suppress it or hide certain emotions from our children, or not admit to feeling those emotions.
Yeah.
But that's the worst thing you can do, because we are still that person.
Yeah.
And those feelings and those triggers, you don't realize how much you are triggered until you have a child. And then you start to think, I'm triggered because my parents were triggered when I used to behave like that.
Yeah.
And you start to kind of unpick this cycle of parenting and knowing what
cultural norms, and how that carries on being passed down again and again. And I think that's one of the biggest areas of interest for me, is patterns that we learn, that we continue, and then we end up feeling guilty about it. But it's all we've known, and it's in the subconscious. And our subconscious is 95% of our thinking. I say it all the time. So it's about making the unconscious conscious and doing something different if you feel uncomfortable with it, but also normalizing certain things as well, because you were mentioning there about the way it's very, very normal to scream at your child or shout at your child. And if you look at animals, because we do go into the primitive brain when we're extremely tired, when we're not eating properly, when we're not resting, when we're in pain, we are now in the chimp brain, and we will behave like an animal sometimes. I'm not saying that that's okay all the time, but there are triggered moments, like you say. And if you look at a dog, when that dog's ready for the puppies to go, and the puppy goes to latch on for milk, and the puppy knows. Well, essentially, when you're going, go to sleep, that's what you're doing. You're doing what the animal would do, which is giving the signal. However, it can become problematic if you're not getting the support, and if you're not telling anybody, and if you're just trying to put on a brave face, which is what so many women do, because they are ashamed that they're not the perfect parent, because that's all they know. They've not been told that this stuff happens.
No.
So how long was Henry in, did you say?
He was in the NICU for 4 weeks. So he it became apparent in the first 24 hours that they suspected he had something called ichthyosis, which is you can either acquire ichthyosis or you can be born with it, and it's genetic. And there were concerns that he was deaf and that he had Down syndrome.
Right.
So he was, initially there to save his life. He was on a CPAP machine and caffeine drips to keep him his heart going, and he was amazing, actually. Like, he bossed the NICU period. I remember looking at him on like day 3 and thinking, you are going to be a nightmare. Excuse me. I could see it in his body and his fit. I was like, you are here to survive. And I don't know, it was it was like a thought that just came into my head, and
like intuition.
And I said it. My mum was on the other side of the incubation. I looked at my mum and I said, he's gonna be a nightmare, isn't he? And she was like, yep, he is.
Wow.
And he is in the best possible way. But congenital ichthyosis, children don't survive that. Babies don't survive congenital ichthyosis. And there was talks of him having a harlequin ichthyosis, and because he looked very harlequin, and not expecting people to know what that looks like, and I won't try and describe it, but it's it's not, they don't really look human,
right,
these babies, and it's it's hard to know. I think because it was, our small local hospital was everybody was very interested in him, and eventually we got his genetic testing back that he didn't have Down syndrome, and actually the markers that he had for Down syndrome were purely down to the fact that all of the skin he'd shed in my womb had stuck to his body and kind of misshapen the way he looked.
Oh, wow.
And the reason I went into premature labour was because he was shedding his skin in my womb, and the womb was becoming a hostile environment. My body needed to get him out. And it's also very common for women that carry ichthyosis children to contract for weeks, that they told me wasn't possible. And I took a lot of it was great telling them that was a thing.
You were like, can I just let you know that you were wrong and I was right?
There was no need for the Buscopan. This was all contractions. So we eventually found out that he had something called IPS, which is ichthyosis of prematurity syndrome. And there's a 1 in a million chance of him having that. He's the 18th in the world with it. And the prognosis is good. Like, he'll always struggle with his skin and his skin barrier. It's very hard to describe what his skin feels like. But if you were to look at him, you wouldn't know he had ichthyosis, but to feel him, his skin is made very differently, and he struggles a lot with his skin.
What sort of symptoms does he have? Like eczema, that kind of thing?
He has, up until recently, he didn't have any problems with his skin, actually, infection-wise or eczema, but he has recently started with psoriasis.
Right.
But because the way his skin generates, it thickens very quickly.
Right. So is it harder if you like thicker, like a tougher?
It's thicker and it feels like sandpaper texture.
Right.
And he doesn't absorb kind of moisture, or like if he has a bath or he goes in the sea, for example, his skin is a nightmare.
Right.
But we had to learn all of this kind of as we went, because there wasn't any.
Because he's 18th in the world to have it.
And it turns out that me and my then husband had both given him that genetic mutation.
No way.
Yeah. So they were like, we need to genetically test you two to make sure you're not related. And I was like, you're telling me that there's a possibility I'm related to my husband and my child is in intensive care. Like, this could not, please God, do not tell me. Anyway, obviously not. That's not the case.
That must have been absolutely horrific.
I mean, I laughed a lot when they said that. I just thought, you can't write this situation. But ultimately, kind of what, he, like I said, he nailed the neonatal period. He came home at 34 weeks gestation. He was attempting to breastfeed. I was struggling with milk supply, and it was then that I realised that he was tongue-tied.
Yeah.
Just like my first child was.
I'm so glad you brought up tongue-tie, because I really struggle with breastfeeding.
Got a lot to say about
Oh my God. We're going to move on to that. I'm just really glad you brought it up, because it wasn't really a thing when mine was a baby.
And this is the problem.
Yeah. And I was beside myself. I felt so guilty. I felt so dreadful. But anyway, carry on. Sorry.
No, it's hard to summarize what I want to say, but I think we're only still battling with his health because he is tongue-tied.
Yeah.
And that's made me very angry. Yeah. And I have a lot of kind of resentment, and it's driven the narrative that I'm pushing about baby sleep, and that there is a normal and there's an abnormal, and the more we know about what tongue tie affects and causes, and the better. Because if this education and this knowledge was within the NHS, my son wouldn't have had 90 hospital admissions in the last 4 years with aspiration of reflux.
Wow.
And pneumonias, and he wouldn't have been tested for cystic fibrosis, and he wouldn't have had abnormal blast cells which indicated leukemia. And just this January he had a patch on his lungs that they thought might have been a cancer, and actually that all turned out to be an enlarged thymus gland because of the amount of steroids he's been on in his 4 years, because of the chest issues he has. And it's very hard to explain why that's happened to him. And I think having the business has been what's kept me alive 100%. It's been my therapy. It's being able to have a platform to talk about what can be done. Like, I can analyze a feeding video of a baby and know instantly. I can't say your baby's tongue-tied because I'm not there. I'm not doing the assessment, but I can tell them where to go for that information and the right care. And it's not as simple as there's a restricted tongue, we need to cut it. And that's the main,
that's what they do, isn't it?
It's a muscle, and it's the only muscle we're not rehabilitating when we're cutting it free, but not teaching it what to do after. So these mums are struggling with breastfeeding. They're knowing themselves from research that they're doing that their baby is tongue tied. They cut the tongue and they think that that's going to be it, and it's not.
No.
Sometimes it is, and sometimes it's not. And obviously I'd like to say there are lots of tongue-tied people and children that feed fine and don't have a lot of symptoms, but actually there'll always be some things, like as a tongue-tied adult, the things that I know I struggle with because of my oral function. But Henry he's only been so unwell because of that, and having to fight for him for the last 4 years to be heard and be, it's got to the point now that when we are admitted, I don't say anything. I'm just like, treat him and get him better, and we'll continue doing what we're doing at home, because there's a thing called myofunctional therapy that helps you with your kind of airway and your tongue posture, and
what's myofunctional therapy?
So it's basically tongue exercises to strengthen your tongue muscle,
right,
and tell the tongue what to do when you're eating and you're sleeping and you're breathing. Your tongue's imperative to the way you breathe, and we don't sleep well if we're not breathing properly.
That's right.
And what I am trying to say is that there are people out there that are pushing this narrative of leaving your baby to cry, sleep training. And it is the main narrative. I did it with my first child. The NHS will still tell you to do that the thing you have to do to help your child sleep is teach them how to self-soothe. We cannot do that. We're not capable of that. We're not capable of that as an infant. Or self-settle, or whatever you kind of want to say. And I'm trying to say, if your child is waking up every half an hour or an hour, they're constantly grumbly and unhappy, they're spitting up, or they're being sick, or they're colicky, and we need to check what their tongue's doing. We need to check how they're feeding. We need to check if their mouth's closed and they're nasal breathing when they're asleep. And there are people making huge waves and doing lots of research about this across the world. And we need it here. We need to, because we're doing things that are against our instinct as parents, because we're desperate for sleep.
And that's trauma for the parent and for the child. I mean, we know that trauma can begin in the womb, but those first few months, I mean, I'm telling you now, I made a lot of mistakes myself.
Who doesn't?
Yeah. And that's because, again, the education's not there. People like you weren't around. No. The internet wasn't really, especially social media. When I had mine 16 years ago nearly, there was nothing like what there is now. And it's why I really believe this is so important. One of my goddaughter actually recently had a very, very traumatic birth. Really traumatic, and it was traumatic not only for her but for her mum that was with her, because they were at home, and there's still not a lot of support and education around it, and I feel desperately sad about that.
I think there's a lot of strands to this. It starts with the pregnancy. It starts with informed birth choices. We're expecting women to give birth to children and then just carry on.
And it can be so traumatic.
And even if you've had the best birth with no complications, those women still need support. Like we need a better system. We need more education. We need to be empowering women more to know what to do, and actually empower them to trust their own bodies and minds and instincts when it comes to their own children.
Massively important.
Because I don't use this term lightly, but I hear of women being gaslit a lot around their children, and especially if they have a feeling or an instinct about their child's health and they're simply told that's not right. And they know it is deep down, and that can send you crazy if you're being constantly told, like I was, there is nothing wrong with him. He has got reflux disease. Here is some medication that's going to inhibit acid production in his gut so that he's not in as much pain. But what else is that medication doing? We're not finding the cause of this. And then we've got children that grow up to be adults with allergies and sleep disordered breathing. And then they need tonsillectomies and adenoidectomies, and they are put through such unnecessary trauma and stress. But if we just focus on that first few months and nurture the mother and nurture that relationship and tell her what we could be doing and spending quality time watching that baby feed and, spending a good amount of time getting to know that family. I know that's not possible within the NHS. I know that we've not got the funds to do that, but
because
life,
they're being wasted.
yeah, but
That-
there would be healthier adults
Yeah.
if we just helped them when they're first born.
It's so frustrating because I've got to say this. I know through working with my clients, some of them, that the amount of money that's spent now on locums and agency staff, um, and the amount of people that are working, you could see a doctor in Egypt or Greece online now because they're working as a locum and they're getting paid almost double the amount of what a nurse or doctor here would be getting paid. So there's a massive pay issue, there's a massive system issue. And you reminded me of a story actually of I was struggling to breastfeed, tongue tie issues, and I started to use nipple guards, yeah, just because I was in so much pain. It was like someone was stabbing me in the tits. To be quite honest,
it's the worst pain.
It's the worst pain. It was
Yeah.
horrific. I hated it. And I didn't matter what I did, what pillows I used, what position I held her in. It wasn't happening.
It
wouldn't work. So I put
No.
these nipple guards on. Health visitor comes round, goes into my kitchen without asking permission, has a look on the side where they've obviously been sterilised. Went, what are these? I said, actually, another midwife has said, just try it. So she was a bit more forward thinking. And I said, they're nipple guards. And she was like, well, you shouldn't be using them. You've ruined the flow of milk. You've put the pressure that's different. Da, 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 da. Anyway, she had a go at me. My sister was there at the time on the sofa when this wonderful health visitor came. And she said to my sister, I don't know why, but she asked how old my sister was. My sister said she was 35 at the time. So again, it was a long time ago. She's a bit older now. I won't say how old. And she said, have you got any kids? And my sister sort of said, no. She goes, are you going to have any? And my sister said, I don't know. And she basically said, well, if you don't have it soon, you're going to have a baby with Down syndrome. And so that was the kind of health visitor I was dealing with. And I was struggling with my mental health. I'd got OCD. I was struggling with really agoraphobia. And I had a massive germ phobia that came on in the early stages of pregnancy and carried on throughout the first year after she was born. I didn't tell anybody because I was embarrassed to say, well, I did try to tell people, but I didn't know how to tell people because I wasn't sure what was going on myself. I actually thought everybody else was a bit strange and I was normal. But there was no real support, education, information, nothing like what you're doing. I mean, that would have just blown my mind at the time if I'd have had access to that.
Yeah, and I think that I'm so personally involved with this that sometimes I think I'm quite an intense person. I talk a lot, and I think sometimes I'm like, there's this and there's this and there's this with these parents. They're like, okay, and then I'm like, we'll just rewind and go through it again. But it's like I said before, like lack of curiosity. What that health visitor should have said is, why does this woman need to use these nipple guards, nipple shields? Why is feeding painful?
Yeah.
Let's look at what you're doing wrong.
Yeah.
No, let's think about why it's painful. It shouldn't ever be painful. But still, when I say that, people say, well, actually, it does hurt no, it shouldn't.
Yeah.
It shouldn't hurt.
Yeah.
And that could be down to lots of different reasons. And it doesn't mean that you're doing anything wrong or that your baby's doing anything wrong. It just shouldn't hurt. And it doesn't even mean that we need to be doing anything. But if it's hurting so much that you're not having a milk supply and your baby's hungry and then you're having to use formula, maybe you didn't want to do that. And I did it with both mine. Went to formula because I didn't know how to help me produce more milk. Or
what are you going to do? The babies need feeding.
And interestingly, tongue tie was such a massive part of that period when a baby was born before formula was safe to give babies, because those babies would have died without a tongue tie check. So, but now formula's safe. We're not putting as much emphasis on it.
That's really interesting. I didn't know that.
Yeah. And just sometimes it's not about a tongue tie. Sometimes a child can't use their tongue properly because of the way they've been born. And they have a lot of musculoskeletal tension. And there are, in Sweden, a baby doesn't leave the hospital without osteopathy. But
because we do that here at the clinic. We do the baby osteopathy.
And it's life-changing. If I had if I had a set of 5 wishes for every family, it would be free pediatric osteopathy after birth, a free tongue tie check and division with pre and post care after, infant feeding support, not just with breastfeeding, but we need bottle feeding support. Like we
Yeah,
need
we
to
do.
know
Yeah.
in what position to feed a baby, how to win them, in what position. You don't need to move up a teat size. All of these things that are not talked about. Proper mental health support and access to that. And there are countries getting this right.
I know.
And
Actually,
it's life changing.
This shows you this is systematic in this country. I've got to give her a shout out because she was Jas Nicholson.
Mm-hmm.
She was my midwife throughout my pregnancy, and we became friends.
Yeah.
She left midwifery, and then she went and did some work around tongue tie, but she's also just done the cranial. What do they call it? I say cranial osteopathy, but there's a name for it. It's
Cranial
craniosacral. She's just gone and completed that as well. So she's the midwife that she was the one that suggested the nipple guards because she could see I was struggling, but she saw the bigger picture.
Mm-hmm.
And it's people like you and people like Jas and people that are looking at what other countries are doing that are so much better than what we're doing. And I don't want to slag off the NHS because I really appreciate the NHS, but at the same time, it's not the nurses and the doctors' fault.
No, it's not
the government. They're obviously trying to privatise it. And in the meantime, there are lots of people really, really, really fucking struggling.
Yes. And I think that's I don't have a solution. I don't know where it's broken. I don't know, but there's an amazing ENT doctor in America who is doing a lot of he's a huge tongue tie advocate, and he's really shouting. He's really on his soapbox about this at the moment, and it's very much needed. But he is saying, consultants, ENT consultants that work with babies, go, if the education isn't there, don't just assume that it's not there because it's not a thing. Go and educate yourself. And I know that time is an issue, but we have to do something within, and there's a link between tongue tie and ADHD and tongue tie and sleep disordered breathing and snoring, and what sleep disordered breathing then does to the developing brain. And as a tongue-tied adult who's recently been diagnosed with ADHD, I know that the ADHD is a symptom of trauma, of being in fight or flight, of not ever engaging my vagal nerve, vagus tone. And yes, I now have these symptoms that match ADHD. I'm not too sure how I feel about it, but I know that it's come from
a variety of different reasons.
And there's a group of doctors in America actually at the moment that are saying if a child is on the ADHD pathway, they need a sleep study and a tongue tie assessment before medication is given. That is what we need in every country.
That is profound.
Very
profound. Because we look at I look at trauma and ADHD a lot, but you talking about, I had no idea about the link to tongue tie and sleep, which is so I'm learning something, and I'm sure anyone listening, I mean, I didn't give this enough credit where credit's due, and the producer will give a hook to us to hook us in, and he'll find a part, because my introduction was never going to do this conversation justice, because there's so much that you're saying that's going to wow a lot of people, I think.
Yeah, I think that I'm struggling a bit with that at the moment, because my clients will say you're not a sleep coach.
No, you're not.
It's a lot more than that. And I like to think that, I mean, the hand holding, and that's the part of the job that I love, but just giving parents the knowledge, telling them that the fact that the baby's waking up every hour is not anything that they're doing wrong. And seeing the weight being lifted off their shoulders, because they'll be told it's because your baby can't self-settle and you've not taught them how to do that. That's not true. Your baby's in pain. Your baby is perhaps lacking iron because their tongue's not moving properly. And we know a lot about being tongue-tied or having oral dysfunction if your tongue's kind of limited in its movement, that our oral microbiome and our gut microbiome are slow to send messages to one another. We can be slow to absorb things like iron that massively impacts on sleep. We're prescribing, we're giving people a sheet of A4 paper to say, this is how you teach your child to self-soothe. We know that part of our brain isn't mature enough until we're 25.
Yeah, that's right.
So why are we saying that babies can do it?
Yeah, that's the prefrontal cortex you're referring to there,
Yes.
isn't it? Yeah.
I mean, you will know a lot more about that than me, but I've been reading a lot about kind of the nervous system and the ANS and the polyvagal theory, and that says everything you need to know about sleep training.
This is why, you know, when we talk about trauma, and I say this all the time, you mentioned it there with you and your best friend. And, you know, again, when people compare and despair, they'll go, my story's not as bad as yours. And, you know, hear that a million times. But the point is, and I talk about the vagal nerve a lot, and I talk about microbiome a lot. We know our gut microbiome is more unique than our DNA. You know, there's so many different things that we need to look at in terms of trauma. And trauma isn't just about the event. Trauma is about how it manifests physically. And also, if your child isn't able to so I said earlier about my daughter didn't sleep very well. She wouldn't go in a Moses basket. She wouldn't go in a crib. She did not want to. She would cling on to me with, you know, fists on whatever item of clothing I was wearing. She weren't letting go. And I knew instinctively that I wanted just to hold on to her. She needed that. She needed me. And everybody would say, it's probably you that's causing this, Ella. It's your anxiety. And I used to think, shut the fuck up. It's
Don't
not
tell me
my
that one more time.
And I'm sorry to swear, everybody, but I used to get so angry with people telling me that it was me that was causing it. And I knew it was how she was feeling. She wasn't self-soothing particularly well. She was tongue-tied, you know, and there was so many different aspects, which if I look at some of her, which I won't talk about her too much because she won't like it, but if I look at her now, some of her behaviours are clearly coming from those early months. And it's so important to understand that trauma is not the event, it's how it manifests.
Yes. And when I said lack of curiosity before, so what your daughter was doing is very normal. That's how we bond, through touch and smell, and she wanted to be close to you, and that's normal baby behavior. But if your baby is never lying on their back in their Moses basket or their cot, they simply will not be laid down. Let's think about how that birth was. It sounds like she may have been back to back if your pain was in your back. So what's that done to her cranial nerves and her? Was she in a bit of pain? And the only way she was comfortable is to smell you, to feel your heartbeat,
and to be lying on her tummy.
Lying on your tummy upright. Why are we not curious about those behaviors? And we're actually doing more damage by saying you can go the other way that's kind of completely far removed from sleep training, and say, you know, attachment parenting, and, you know, all of that's brilliant. And but that sometimes can also be hourly wakes are normal, and it can happen when they experience separation anxiety. And yes, hourly wakes in a baby can be normal for short periods at a time if they're unwell, if they're getting a tooth, if they are going through an intense period of development. Hourly waking non-stop all their life is not normal. And I'm really fed up of that because people aren't getting help. And they are so in tune with their baby, and they want to practice this style of parenting, or they align with that style of parenting that keeps their babies close, which is brilliant. Like, that's what we need as human beings. But then we're being blamed for the way we've chosen to parent as being the reason why they're waking every hour. But we're still, everybody is, you know, my hospital notes will say overly anxious mother on every admission.
I mean, isn't that just lovely?
Yeah. And I'm like, there's something that happens to you when you're a mother, especially, and I can't say the same for fathers, and I'm sure there is some wiring that happens when you become a father too, but it's happening to our body, isn't it? They're an extension of us. They've lived in us, and there is this instant, you know, not everybody feels instant love for their baby. We don't talk about that a lot either. But there is an instant intuition that's just there. And we don't as new mums, we don't know whether to listen to that. We don't know whether to trust it. We don't know.
Well, especially if everyone else is telling you that you're
wrong. Yeah. And I've never met a mother whose intuition hasn't been
correct.
Right. Yeah. And I think we just need to learn more about where the tongue should rest when we're asleep, how we should be breathing. If we're breathing as if we're in fight or flight, we're not going to sleep.
No, you're right. Yeah.
We're going to come out of that sleep every hour.
Yeah.
But it's not just about the way a child's breathing and where their tongue is sitting and the posture. It's what that tongue's doing then when they're feeding, they're going to be swallowing air. That's going to cause reflux.
Yeah.
Then we're adding another layer of discomfort to that child. And then if they're given things like omeprazole and Gaviscon, what's that doing to their gut health?
Yes.
And then when they do digest actual food, they can't tolerate it as well. And then there's a whole other layer of discomfort for that baby. And it's this cycle that continues and continues. So yeah, it's not, I'm a sleep coach, but I'm working out why that baby's not sleeping.
I wouldn't even know if I was thinking about this when you said it a minute ago. Like, if I was thinking, okay, what would I describe you as? Because yes, sleep's part of it, tongue tie's part of it, you know, the holistic side of it's part of it, but it's so much more than that. You are an educator, and I think, you know, a lot of people say to me, but I haven't done this degree or that degree. You don't have to do that to be an educator. Knowledge is power. You hold a lot of knowledge. You've got a lot of lived experience, so you can really empathize. But you seem to be really passionate as well. And I would just say that you're like, it's like you're the best friend to new parents.
Oh, that's really lovely.
Because it's true though, and you can't find a title that fits yet. I'm sure you will, because I know one of the things that you want to do is to actually train people to be a coach in the way that you are. And we said earlier, didn't we? You know, you want to train sleep coaches, but I don't think you could even call it sleep coaches, because what you do is something completely different.
I think that's what, like I said, I kind of touched on it before, and I do think it's important for me to say, because I do feel like I'm at the point now in my career that there is the lack of medical degree is holding me back from being heard. My biggest trigger for my mental health is not being heard. And I was listening to the most recent podcast you've released on the way here, and so much of it I was like, yes, like you don't need the qualifications to prove what you know, what's in your brain. But I feel like maybe this is a trauma thing, maybe what, I don't know, but I feel like having something like a medical degree, would it give me validation? Would it give me a standing? Would it give me a bigger voice? I don't know at this point.
It's interesting because when I went through what I did in childhood, there wasn't any services available. So I didn't really have a benchmark for who I was then going to be. I just knew I needed to be the person that I didn't have. And I've used my whole career is based on that. Now, that doesn't mean that you need to have gone through childhood abuse to come and see me. I mean, you could have had a car accident and have trauma, or, you know, be a child that you know, perhaps wasn't looked after very well for whatever reason. It doesn't mean that they weren't looked after very well because the parents were shit. It could just be that the parents didn't have the information. So whatever the person's coming to me with, I just want to be for them what I didn't have, which is someone to hear, someone to offer the education piece, and someone to just carry me through that time. And when we spoke about sleep a lot there, well, I use EMDR, which is based on the theory of REM sleep. So that we know sleep is so important in terms of reprocessing trauma as well, using the way the brain goes into bilateral stimulation during sleep, using that theory and using bilateral stimulation not only as a way of reprocessing trauma, but a way of self-soothing as well. So it's all so bloody linked.
I know, and if we just thought more about the link between all of these things, like, I don't want to say, because a lot of people will sleep, you know, I sleep trained and I do feel a certain way about doing that, but I did it because I believed that was the only way. And it was the information I was given by health professionals that I trusted. I don't know what we need to do to make these people understand that we're inflicting trauma on children and parents. And it is absolutely not necessary. We just need more time.
And can I just specify there, because I think this is really important. I would say that my daughter has got nervous system trauma. So when we talk about trauma, I want to make that very, very clear.
Mm.
A lot of the experiences that she's had growing up has been nervous system trauma, which manifests as anxiety. But she's been very, very loved, very, very loved, very heard, very seen. I'm not saying I've never lost my temper, because I definitely
No.
have, but she's had a lot of love and a lot of support. Hers is nervous system trauma, and it comes down to those sleep and tongue tie issues. And I want to just say that, because people hear trauma and they don't always understand
No.
there's different types of trauma. There is emotional trauma, and there is physical trauma, and there are, there's sexual traumas, but nervous system trauma is this sort of trauma we're talking about, where, they're being expected to self-soothe before they've even got the ability to do so. And I really just wanted to specify that, because that might make a lot more sense
Yeah,
to people.
exactly. That's massively important, because we hear the word trauma, there's only negative kind of connotations that come along with that word. If we're told that our child is waking hourly because they're uncomfortable, the first thing we're going to do is blame ourselves for not knowing that. And that's natural. I think that's because you love your child so much that who else are you to blame? Like, you need to blame someone for your child being uncomfortable. No, let's think about
and you are being gaslit as well, actually.
Yeah.
So a lot of the time you are being confused by the health professionals, even today.
Yeah.
And this happens, by the way, in all types of health. Be it the other day, let me just tell you this story, slightly off topic, and I'm really passionate about this bit. What you've just said there is that we blame ourselves. I'm working with a girl who definitely shows every single sign of having ADHD. There is some trauma early on. I always write a letter if I suggest they go to the doctor and see if because they can't always afford private assessments. So I always write a letter, and the doctor didn't even look at the letter. He said, no, I don't need to see that. I'm going to put you on antidepressants. We know antidepressants can exacerbate the symptoms of ADHD. So what he's done is, I've got almost 20 years worth of experience. I trained on and off for 5 years to become a psychotherapist, hypnotherapist, and so on, and done countless amounts of hours of training ever since. We know that GPs get a very small pocket of training in mental health. Yes, they're prescribers, so they're allowed to prescribe medicines, but to not even read the letter and not hear that. Now, we're going to see that with young mums as well. What you were told, no, you're not contracting. Women say, my baby's waking up every hour. Oh, just try this, try that. But their instinct, their intuition, their knowledge of their baby and their experience is often completely ignored, and they end up very confused.
Yeah. And we need more holistic. The word holistic is still bandied about, and it's also seen as airy-fairy.
It is, yeah.
No, that's exactly what we need.
Yeah,
we need holistic healthcare, especially from the day that mother becomes pregnant until that child goes to school, ideally longer. We need that. But that exact story happened to me. I was going back to the I've got anxiety. They were telling me I had OCD and PTSD, and because there was a lot of history of trauma there, and I was put on sertraline for years. That exasperated.
So much worse.
And then since coming off that and being on, I'm trying ADHD medication at the moment, that's been life-changing. But I know I have a lot of nervous system trauma and childhood trauma and layers and layers and layers of trauma. I know that my body is in permanent fight or flight, and that I'm not getting the sleep that I need. I'm probably not looking after myself. Like, I'm not sat here saying I've got 2 perfectly healthy children because I'm the best mother in the world. I never lose my shit. I'm never depressed. I always lose my shit. And I am down. I'm going through a lot of personal things at the moment that are making those triggers more shallow. Is that the right word? Like, I am reacting and responding to things that I probably wouldn't normally. I know what's happening to me, and I know why. This is about, like, what the reason you do your job is the exact reason I do mine. Because if I had someone that was telling me this, then it'd have changed not my life, but it'd changed my son's life. And with you saying the GPs are giving out these prescriptions, we need to be thinking of the consequences,
which there
of
are
that.
a lot of. There are a lot of, because imagine that you start to feel, okay, I've got a lot of serotonin now because I've been given sertraline, which is an SSRI for those that don't know. Okay, but my ADHD symptoms are worse and I'm being really risky because that's part of what ADHD is. You know, I might be out there seeking things that are going to,
Dopamine.
dopamine, exactly. So I know that you were talking about, you know, maybe I should get a medical degree or whatever it is. And I'm not suggesting that you shouldn't, because that might be something that you're really interested in and it really might help your career. But I guess the message I want to get across here, yes, I'm a psychotherapist. Yes, I did lots of training. Yes, I still do countless training, and I always will. But actually, some people are just born to do this. Some people have got a real passion, a real purpose, a real understanding. They have all the knowledge. They may not have the degree. I think it's always good to have something that gives you an accreditation so that people can, if there are things that we need to, certainly we need to keep people safe.
Yeah.
So we all need to be working to a code of ethics and so on and so forth. So that for those reasons, I think accreditation is important. But medical degree in your case would only enhance what you do.
Yeah.
What I think is that you shouldn't need it.
No.
To be heard.
No.
But actually you are right that in certain circles, not the lay person, not the person that actually needs you, by the way, but the people that back you up.
Yeah.
But like I told you there, as a psychotherapist with the qualifications, the accreditations and everything else, they still don't listen to me. They still don't listen to me. And I find it really, it's not an ego thing.
No.
I care about the person going to them. It makes me angry because the person that needs them to hear me
and not getting what they need. Yeah.
And that's the bit that bothers me. I don't care whether you respect what I do or not, if you're a doctor or whatever. And most of them do, by the way.
Yeah.
But the ones that don't, I don't care whether, it's not about that. It's about this patient and what they need.
Yeah. I've now started. So I can tell a parent, so let's say I'm suspecting that the child might be low in ferritin, iron stores, and that's why they're waking a lot. I will tell the parent the symptoms of that and what they need to do to find out for sure.
Yeah.
You can't, and that's obviously because I can't say for sure. But when then I will always write a letter knowing that 50% they'll be like, a sleep coach? What is that?
Yeah, like, you don't need that person.
Yeah.
They're a charlatan.
Exactly. What I started to do is write a letter explaining every symptom this child has, connecting that to the evidence, citing it. I go OTT.
Yeah.
And I'm like, we know that low ferritin means we lack sleep spindles. Sleep spindles are specific brainwave activity that put us into a deeper sleep. So there's where you can find that information. This child has this, and this symptom. They're behaving like this overnight when they wake. Would you consider having a blood test for this child? But that's happening a lot.
Yeah.
Like, there is a definite, I don't know what the connection is, and I don't even know if I'll get in trouble for saying this, but I am seeing children that are born with musculoskeletal tension, either from a forceps or emergency section or ventouse or whatever it is delivery. Their tongues are not working as they should because their neck's tight and they can't quite get in a comfortable position and they're just locked. Whether they're tongue-tied or not, maybe some of them are. They're not getting that help. They're then swallowing lots of air on the bottle or breast, and then they have an inflamed gut, and then they are prescribed PPI medication that inhibits acid production. They're then given food. They then get eczema. They then have allergic reactions to food. They then continuously mouth breathe.
Everything you've said, whether you're allowed to say it or not, I'm going to keep it on it because
I don't care either.
I might add a special note on, just for the sake of it. But actually, everything you've said makes perfect sense. Everything is linked.
And my brain, whether that's the ADHD or not, but I will pick up a pattern in families that I work with. Then I'll need to go and work out.
You join all the dots.
I join the dots, but with the research and with the evidence, with the stuff that's on BNF and with the things that are published literature.
Published research,
And I've got a client who is an A&E emergency consultant who came to me, and I told her that her child had reflux, a tongue tie, and musculoskeletal tension. She listened to my advice and it changed her son's life. And she's been such an integral part of my journey in life the last couple of years, because she, as an A&E consultant, was saying to me, you need to continue to do this because
Yeah.
we're not taught it.
Yeah.
I didn't know how to help my son, and I felt like a failure.
Yeah, even more so because of their
because of my
title.
profession, and I felt even more like I couldn't talk about it because of my
Yeah.
profession. But it's her that I'll ring her and I'll be like, I found another link. Is this legit? She'll be like, yeah, that makes sense.
You're going to change the world. You know, this is honest. I'm not just saying this. There are women like you out there doing this work. And I know there are more. But again, we don't know of them all.
No.
But you are going to change things. If only there was more of you, which is what your plan is to do, isn't it?
Yeah.
And I've got to say this. I don't know how much you're prepared to say, but you are going through some life changes. I know that if I can say, can I say that? Okay, so you are going through changes in the marriage, and that has sadly come to an end.
Yeah.
It's a fairly new thing, isn't it?
Yeah.
But what was so interesting, and I know you're going through a really difficult time, and I know it's really painful and really it's a struggle in every single way, shape, form, isn't it? But you're still determined to go out there and within a year or two be educating others doing what you do.
Yeah.
Certainly trying to bring up a whole network of coaches that you're training. And you could go off and do the whole medical thing first, or you could bring medical people on board with your business so that you can just focus on being the educator. But whichever way round you do this, I know that you are going to change the scope of what being a parent looks like.
I hope so. There's obviously a massive part of me that needs to be heard, and like somebody to say, yeah, you're right about that.
Yeah.
And why do I need somebody that's maybe high up in the NHS or a consultant or someone to say, oh, you're onto something here?
Yeah.
Like, but that's me personally needing that, I think, because of Henry.
Yeah.
We saw an amazing ENT doctor at the Portland Hospital in London last week who looked me in the eye and said, you have been right for the last 4 years, and your son needs to have his tongue divided, but he also needs his tonsils and adenoids out because of how much he's compensated for that tongue tie, which is everything you've been saying for the last 4 years.
Wow.
And to hear that,
my hairs are standing on end listening to that.
And my husband, well, he's still my husband, and my child's father was in the appointment with me, and he looked at me and he knew I needed that, and he knew that he probably hadn't given me that, like he hadn't said that. It was just a very poignant moment, but it's not, I thought it'd like heal the way I feel about everything.
But that's going to take time.
It is going to take time, and it has helped me know that I've been correct. But I would never doubted myself. I just needed to be told I was.
Yeah.
But professionally, I do get a lot of people in the industry that don't like what I'm saying because it goes against everything that their business stands for.
Yeah.
Which is to sell these PDF guides that teach your child how to self-soothe. And they don't like what I'm saying, but if they didn't believe or didn't really think there was a truth to what I was saying, they wouldn't speak about it. And they are.
Yes.
And even that, I'm like, okay, I am getting in people's brain. I'm not going to be quiet. I'm not going to stop talking about it. And I'm going to piss a lot of people off. I know that.
But that's good.
I need to do it.
Because when you're pissing people off, you are making changes. You don't make changes in this world unless you've made a few people angry in the meantime. That's the truth of it.
I would say, right.
It's so true. Like if you're making people angry, you're doing something right.
Yeah.
Because you're breaking down those belief systems and those systems that other people rely on to make their money. Well, that's not good enough because this isn't about money now.
No.
This is about making sure that information is out there so other people don't have to go through what you went through.
Yeah.
Or even if you're listening to this and you feel like you went through something milder, as a woman, your hormones can change for a very, very long time after you've had a baby. That alone, even if you've got the most, there's no such thing, but the ideal situation for your baby, the baby sleeps, it's not tongue tied, they're not tension in the neck and in the head, they're breathing correctly, everything's perfect there. Your hormones might still be all over the place and affecting not only how you feel about yourself, but how you feel about other things. Like I'm pretty sure that my previous trauma with sexual abuse, and I spoke about this in the TED Talk, was what brought on the germ phobia, because the way that I think of it now, looking back retrospectively, was within 2 weeks I fell pregnant straight away. Within 2 weeks I was bleaching the surfaces in my house. I was picking up litter outside of my house. Like this outside of this building here would have been a nightmare for me because there's litter everywhere today. But I was going out with a bag, picking up all the litter. I did that all the way through the pregnancy. I was nesting from early on, if you like. When she was born, I was so petrified she was going to die. You saying that earlier really resonated. And I couldn't bear anyone going near her with any germs, to the point where I very rarely went out. And I think that's because I was trying to protect her. So I think I was overprotective in that way. But separately to that, she was also unable to sleep on her back, unable to be put down, hyper clingy. Well, the word clingy isn't fair, actually. She just wanted to be on me all the time.
Survival.
And then I was gaslighted. Oh, it's because of you, because you're this, because you're that. There was so many different facets going on at the time. But like you say, no one was curious.
No.
It was all my fault.
And then what is that then doing to the mother? To be told that it's their fault, to then be told, because there are people out there that say your baby must wake at 7 o'clock every morning. They must go to bed at 7 p.m. every evening. It doesn't matter how old they are. They have to have 3 naps. They have to have a 2-hour lunch nap. Can you what if you were an
that would
anxious
never have
mom?
Worked.
No, but this was me with Arthur though. Like, I was so anxious and I was like, oh my God, it's 7 o'clock. He's got to be awake. He's only had an hour and 45 minutes for his lunchtime nap. What am I doing wrong? And I'm panicking all the time. They're not following the schedule that this person's sent to me, because that's not life. It makes me so angry that I wasted a year of my child's first year, fitting him into a box he was never going to fit in, making myself more ill. And if somebody had said, some children are lower sleep needs, some children prefer to go to bed later, you've got to let sleep pressure build before you put them to bed. You can't do a set bedtime every night, because they may have woken up from their nap at 3 p.m. and not be tired enough for bed.
And then
7.
they're just going to be really pissed off that you've forced them in their cot.
And let's talk about how sleep works. Like, that's not how sleep works. And that's what annoys me, because I think mothers are getting more unwell because of the bullshit they're fed every single day about how to do it. And it's not how to wean, how, it's damaging. It's really damaging.
It's damaging. It's like saying you've got a headache, take a headache tablet. It's like saying, oh, you've got constipation, perhaps you need to eat a bit more fiber. It's not that simple with a baby and a mother, because there's so many different parts. Like you say, you're really listening with curiosity and you're understanding the evidence. And this is your passion. You're understanding all these different parts of having been a mother, having had a lot of trauma. You are listening for the holistic point of view, every single part of this person's experience.
Because I'm genuinely interested, and not just in helping that family, but it's maybe the neurodiverse aspect of my brain. But I will read an intake form from a family, and I'll analyze their sleep diary, and I'll watch the baby feed, and straight away my brain has got all of these scattered jigsaw pieces. And I'm like, I have to put this together.
That's how I work. It's so interesting.
It is, isn't it? And I'm like, well, I've got to talk about this. And that's why I say sometimes at the beginning, I have ADHD. I talk at 1,000,000 miles an hour, and I'll probably just fire information at you. But then that's how I need to tell you. And then I'm going to go back slowly and talk about each thing.
It's
because
really
I know
fascinating, because I can see that your brain, when you're talking about this, sorry to interrupt, but I wanted to show you what I see. Your brain you do very similar style to me, I think. And I think the trauma aspect of my brain is developed into that ADHD style. So the way that I can't, I'm almost like, this is so exciting. All those puzzle pieces, and I can't wait to see it all put together. And I'm really, the person opposite me, and I see this in you, is so like, wow, no one's ever been this interested in me. And it's the first time that mother in her whole life, and she's going to have a whole host of other things that she's bringing to the table as well, as will the father. It's probably the first time they've ever had anyone be that interested in them.
Obsessively interested.
Just like, you are everything to me right now. And that passion, and that even before they know the answers, that is going to give them so much hope, which just changes the game.
And it gives them, you know, that initial consultation with me that I have with everybody, they get the opportunity to start from the beginning and tell me everything they want to tell me.
And
There's
be
no
heard.
time limit. Yeah. And I'm listening.
Yeah.
We get 10 minutes with the GP. We get, you know, there's not, they need to speak, they need to talk about,
Yeah.
you know, I have a friend recently that had a really tough time conceiving, like lots of rounds of IVF, finally had her baby, didn't feel heard or seen during labor, had a really tricky time, quite similar to me and Arthur. And I went to see her when her baby was about a week old, to help her with tongue feeding stuff. And I said to her, do you feel like you want to talk to me about what happened at the birth? And she just burst into tears. And I said, you don't have to go through it. But for me, actually, I had to, and God bless my mom, because she is so patient with me. And so I think because of the way I describe how my brain works, it's almost like I do have to repeatedly go through everything, because every time I tell that story to somebody that's safe to do that
Yeah.
to, another thought will come into
Yes.
my head that will help me
Yes.
or like make more sense of it.
Yeah.
Even just having that opportunity
Yeah.
to sit down with somebody, even if you've had a brilliant birth, and say, I just really want to talk about my child.
Yeah.
Like, can I tell you how I birthed like a badass and
Yeah.
brought my baby into this world, no matter how you did it? Let's give them a chance to do that.
To celebrate it.
Yeah.
To celebrate the fact that they got through it.
Yeah.
Because even if you have had, and I had a relatively good birth, apart from the fact that I was on my own for all of it
Yeah.
until I got to the hospital. And then, well, I think I was 9 or 10 centimetres by the time I got there. The bloody ambulance driver kept calling me Emma.
Oh, God.
I was like, for fuck's sake. And then we went over I got told, right? This is another thing that I tell a lot. I got told I was going to get, if I needed it, because it's home birth, you're going to get blue flashing lights, right? You're gonna be fine. Everything's gonna. So no, there was no blue flashing lights. He went over every single speed bump while I was 9 to 10 centimeters
Fabulous.
dilated. Got to the hospital. He said, "Would you like a wheelchair?" Because bear in mind, I've been contracting continuously.
Yeah.
Yes, please. Oh no, I can't find one.
Oh.
So I had to walk through. Got there, and then I needed a catheter as well because I couldn't. I hadn't gone to the toilet for so long. Ended up being fine, but had no pain relief. Apart from that one suck on gas and air, and then that made me projectile vomit. Had no pain relief. And afterwards, I was so grateful to get through the experience. I was sort of like, wow. And of course, adrenaline was going
Yeah.
wild, and dopamine and oxytocin and all those things. But looking back, that could have been a whole different story
Yeah,
if
and
there'd
you
been any
bossed
complication.
it.
Yeah, I did. And I'm proud of it. But I'm
Yeah.
also really aware of that it was also quite traumatic.
Yeah.
But I've covered it up with the gloriousness of how it all happened. But for 10 hours, I was completely alone and with
And
constant
scared.
contract. Yeah, I was petrified. And I hadn't, every time I rang the midwife, they'd be like, well, there's just no one available. You're probably only 3 centimeters. And I was like, okay. And in the end, I just knew I had to get to hospital. But of course they keep telling you, no, you'll be fine.
Yeah.
Just do this, just do that, have a bath. I couldn't move.
No, it's you with you saying I had a, you know, it was straightforward. You felt scared.
Yeah.
You felt there was
I
trauma
was
there.
petrified,
Yeah. That's how can we possibly prepare anyone for how it feel like it.
Yeah.
It's such an different pain. It's a different experience. Your body's physically doing something and you're like, what is going on here?
Yeah.
So it really doesn't matter, although it does, but it doesn't matter in terms of how you feel, the way your birth has gone.
Yeah.
And sometimes just talking about it and actually thinking, I did that.
It's
like
amazing.
That, yeah.
And also giving credit where credit's due to Regan, who was my midwife there. She was brilliant.
Yeah.
She really put me at ease and she was phenomenal. And Jess, who I mentioned earlier, she was the midwife throughout the pregnancy. She was phenomenal. But the system was not great. The health visitor that came from a very old school system. The system of those
so it's the training, isn't it? It's like the continuous development of that.
Absolutely. And this is where you come in, like people like you and people that have been midwives that are perhaps retraining and doing things now. changing the world for trauma.
Mm.
Forget about, I know we talk about the babies and the mother here, but actually collective trauma
Yes.
through the nervous system trauma that we're talking about, that's gonna have a knock-on effect.
Yeah, and let's just think about what adults those babies are going to be.
Yeah.
Like, let's think about how society is going to be.
Yeah.
And we're all kind of mouth-breathing, impulsive people that
Well,
are,
yeah.
because, and I know that's what I don't want to do, and what I don't want people to think listening to this is, oh my God, my child mouth breathes. Oh my God, I think my child's got a tongue tie and they're going to have ADHD. No. Just you can't do that. You can't
We're
go down.
highlighting the bigger issues
Yes,
here. Yeah.
and if you're anything like me, that will send you down a rabbit hole and a spiral. And
But at least they're being curious.
Exactly. And if you are feeling like that, there is always things you can be doing, no matter how old your child is, that will benefit them. People say to me, oh, I had a really traumatic birth and my child had a head preference, or they preferred one boob. They always had clenched fists. They hate being in the car seat, but they're 5 now. Would osteopathy still help? Yes.
Yeah, it would. And I would say that because that's what we do here as well. So I'm going to give it a big shout out.
It's incredible. Osteopathy is incredible. Like, it's magic stuff.
I mean, I feel having a multidisciplinary clinic, actually, I mentioned earlier, we've got physios, we've got osteos, we've got gut health people here, we've got homeopaths, we've got, psychologists, talk therapists of all different types, more trauma informed, but beauty, or the whole lot here. And the reason I love it is because there's such a wealth of experience. Reflexology is another amazing tool for babies and for mums. And the wealth of experience within these practitioners, the wealth of knowledge, the wealth of passion and purpose is different to what you get elsewhere, because that holistic approach, we're also they often do group supervision, and I can never bloody go to it because I'm either with a client or I happen to be on holiday. But they're so passionate, these guys, and we cannot discount those osteopathy. Even later on in life, if you're in pain as a mother after giving birth, if you can, go and see a physio or an osteo. Go and see a sports massage therapist. Look after your bodies as well, because I always say about mums, and I remember this, you, and sometimes even, don't have to be a mum to fit into this category if you're not a mum and you're not a dad listening to this, but we prioritize everything else instead of ourselves. And if you prioritize your own well-being, your child gets the best out of you. If you don't give yourself 5 minutes to breathe or to eat properly or to rehydrate, if you don't look at your own sleep, if you don't look at your own body and the pain that you're carrying, the inflammation, the gut issues, you're never going to be the best version of yourself for your child.
I felt like you're talking right to me there.
I was. I didn't want to make it personal, but as you've gone there,
Emily, sort it out. No, I genuinely, I have this thought. I don't know what. I think if I did the work that I know I need to do, that I'd be telling other people to do, that it would. I'm not being the mother I want to be at the minute. I'm shouting. I'm got no patience,
but you'll go through huge life changes.
I am, but there is so much more I could do to help myself. Like, I feel like I've forgotten how to relax. I've forgotten how to. I don't know what I'm when I'm not with the children. I'm not working. I'm like.
It's like your brain doesn't know what to do anymore.
I'm like, what I could. I used to like reading books. I could do some meditation.
How do you get on with reading books when you've got ADHD?
I can read a book in 10 minutes.
You're like skim reading. I know it all.
Yeah.
Wow.
Yeah. I've always been like that. But I know what makes me feel good and I'm not doing it. It's like I'm punishing myself or like sabotaging myself for some reason because of maybe an emotional state. Possibly.
Because it's interesting when people say, I think I'm self-sabotaging. I'm like, actually, I think your nervous system has just put the big stop on.
Yeah.
And it might not be self-sabotage. It might actually be burnout.
Yeah.
Because with everything you're going through on top of the sort of passion that because obviously the passion that you put into your work, I could see it here. I've fallen in love with you, by the way, because I always have a brief chat with people before, and like half an hour or so we had a chat earlier, but I couldn't get the flavour of it until now. Like, this is you and your passion and your traumas and everything that you've been through and are going through. You never know how an episode's going to go until you record it.
No.
This is a banger, by the way.
Good.
Because this there's so many sides to you and you've let them all out here.
Yeah.
Like, you have definitely been authentic and vulnerable, but you've also been completely transparent about the system, the education that you've offered in this one episode,
Yeah.
the journey that you're on, the current status that you're living with at the minute, and what you're intending to do in the future. You've just given so much good food, really, if you
Yeah.
like. It's like been the 3 courses and more.
Yeah.
And it's fascinating.
I feel like I will definitely go away from this experience and think, you went off on too many tangents, you spoke too quickly,
No.
but that is how it must be how I how I think and how I process different things. And when I've got something to say,
Yeah.
I literally have to bite my lip. I'm like,
Yeah.
don't interrupt.
Yeah.
I get and meeting other people with ADHD that constantly interrupt. You're like,
Yeah.
oh my God, that's a thing. We do that.
Yeah.
Yeah. So I thank you. That means an awful lot. I think that it's hard to sometimes the best thing to do is just to sit down and talk about it. And that's like the best.
Well, this is
thing
it.
to do.
This is why I love doing these episodes.
Yeah.
And I mean, love it.
Yeah.
Like, sometimes we wake up in the morning and we don't go, yay,
Yeah.
going back into the clinic today. But
Yeah.
actually, when I'm with the person, I'm just like, I find the human experience fascinating.
Yeah, me too.
From birth to death. I find death fascinating as well. I find the whole experience of human the reason I say that about death is because so many people are scared of death. I am not scared of death. I'm fascinated by death. It's something that we're all going to face. But if we're not getting the birth bit right, you can imagine why people are as petrified about the death bit.
Yeah.
There's the things that we need to talk about. I said this in my very first guest podcast, which was with Dr. Sunny, who's a gut doctor. The things we don't talk about are sex and bowels and death, but also birth. I'm going to add birth into that one now after this episode, is that birth, sex, guts, bowels, and death, they are so important. We need to talk about it more.
Yeah.
Because in this episode, we've, apart from the sex bit, which we know you have to have a baby, by the way, we've covered every single angle there.
Yeah.
It's all linked. The brain is linked to every single part of everything, and the birth is definitely and the womb experience is definitely the first port
and if
of
we
call.
can just get that even a little bit more right, that's not the right phrase, but
I know what you mean.
focus a little bit more on that, just how much things can change.
Yes,
for children, and then
for the parents as well.
Yeah, because we're preventing so much trauma later on for the parent too, because we're thinking about the child's health now, and as they grow, we're doing things that are going to prevent common things that are happening, like tonsillectomies, and how many of those are performed a day, but how many could be avoided if we teach about breathing. Allergies.
I mean, bloody
massive.
allergies. It's a really, really, really big problem. How many kids have got allergies now that never used to have allergies?
No. And that's a common cause of reflux. But is that baby born with an allergy, or is it from medication we're giving them? Or can we just think more about
more holistically?
Yeah.
And I think people definitely will after this episode. I mean, this has got longevity for years to come, because I'd love to know how soon things will actually change. So, as I say to everybody that comes on, if you want this unedited version, you'll get it so that you can chop it up and use it again and again and again. But I would love to see you educating more people and reaching that wider audience through your own system of teaching, so that other people can carry on this work for you.
Definitely.
Because you can't reach everybody on your own.
No.
We need lots more of you.
And I think that's why I'm at burnout, because I've been trying to do that, and it's not possible, and it's not. And then you get the doubt, oh, well, I've not got, and people say to me, well, you're not medically trained, so I would, and it's like,
you don't have to be.
No.
Look, I know that people will listen to this and will have had experiences with people that are medically trained and actually felt worse. So what we need is people that are informed, people that are passionate, people that are educated. You are educated. You, like you say, the way you write your letters to the GP, you cite the evidence, and you make sure that the GP is aware of that. And I know not all GPs, I've got a lot of time for GPs, but some of them are using Google anyway.
Exactly.
So you're saving them,
Yeah. And all I think when I do that is, right, even if that GP reads it, then I've won.
Yeah.
Because even if they think this person is not on a different planet and they're not talking any sense, I
Yeah.
know that that's not true.
Yeah.
But even if they think that, something will go in there.
Yeah, it will.
And when they have a child that comes tomorrow and they're not sleeping and they're pale and they're clammy overnight and they've got cold hands and feet, and maybe they'll think this child might need to get their blood checked. I do it for my own reasons too, because I just think this is the only way I can be speaking to GPs. Because
Yes.
I've even gone to my local GP practice and said, could, because I'm infant feeding qualified, can we run a clinic? So every baby that comes to you with reflux, they come to a clinic ran by me or someone similar.
Yeah.
And we help the family identify the root cause, and can we measure the reduction rates in omeprazole and Gaviscon? And it's a flat out no. And I'm willing to do it for free.
Well, why do you think that
please.
is? Why do you think that is? Because that's pharmaceuticals. That's a
I
big...
didn't want to say it.
Well, I'm quite willing to say it.
Yeah.
I might be cancelled. You might never hear from me again. But I'm willing to say
Conspiracy theories.
It's pharmaceuticals.
It is.
And that's a lot of money in that.
It is.
They're going to make a lot. So yeah, I won't say too much about that, but that's my opinion.
Yeah. But if we just need one person that's got the authority to say, go and do that.
Yeah.
Let's see it. Let's see what happens.
Yeah. So because that is a bit of a task, and you're not getting the inroads, which doesn't surprise me, and that's why most people end up working privately and so on. Because of that, what I really want people to know is where they can find you, and I know your business is going to be building it, because you've had to slow down a little bit with all the personal stuff going on, but you're building it back up. Where can they find you at the moment?
So I'm on Instagram, which is foxandthemoon_sleep. We have a free Facebook community for parents as well. And you just type Fox and the Moon Sleep into Facebook and you'll find that. We have a website, and that has a whole host of kind of easily accessible. There's some free kind of guides about reflux and red flags when it comes to sleep, but also really affordable like webinars and guides, self-paced courses. The one that I've worked incredibly hard to put together is the Ultimate Accessible Baby Solution, which is for parents who just think, my baby's not very happy.
Yeah.
And they're waking an awful lot. It doesn't necessarily mean they have to have diagnosed reflux or colic or allergies. If you just feel like your baby is not happy, that's the course for you. And I'm very proud of that. And it's there's a wonderful woman in America called Mallory Millay, who is a speech and language therapist, myofunctional therapist, tongue tie advocate. And so she's done and she's also a craniosacral therapist. So she's put a lot of material together for things you can be doing now at home to help, little exercises and things. Dr. Rio, who is the A&E consultant, has done a lot on maternal mental health and iron and what to do there. So that course is packed full of reasons, and it's very affordable and very accessible. So yeah, just trying to kind of, and obviously you can work with me one-to-one. You can work with Molly, who's my sleep coach associate, one-to-one, who is phenomenal. Didn't say that word, but then said it right the second time. She is a nanny, and she loves working with people who want to move away from co-sleeping. They want to stop breastfeeding. Like she's very, she has her own kind of set of interest. And then I work predominantly with the children who, they might be 4 months old and having reflux, but they might be 3 and snoring. Like it's working out those kinds of, that's what I love to do. So yeah, you can work with us one-to-one too.
And what's the website?
foxandthemoon.co.uk.
So foxandthemoon.co.uk for the website. Facebook is Fox and the Moon Sleep.
Yes.
And Instagram is foxandthemoon_sleep.
Yes.
Amazing. And I mean, if you were to do something in the future, teaching others, how long do you reckon that would be before you would look at that as a proper viable option?
I'd love to say,
I'm making you accountable.
I know. And I work to a deadline, so I need this. I'm going to say by the end of the year, it'll be written. I'm going to say a couple of extra months for accreditation, maybe this time next year.
Amazing. So around about, so please, if you're interested, even if you're not a parent yet, but you're interested in some of these things that we've spoken about today as for parents. You might be a life coach or a a counselor or a psychotherapist or someone listening to this thinking, oh, I've learned so much about this. This will
Yeah.
be so helpful to my clients. Follow Emily, because you're going to work with mums and you're going to work with dads, and all of us in this field should be aware of the work that you're doing and what you're talking about, not only for the parents but for those children. I mean, I'm 45. I'm going to be working for quite some time. Those babies are going to turn into adults with their own problems.
Yeah.
We need to be aware of this sort of nervous
Yeah.
system trauma that they're
Yeah.
experiencing. So follow Emily and do your bit to support this work that she's doing, and share her work and be really proactive about that, because it's going to change people's lives. And I don't say that lightly. And I'm really, first of all, you can never tell what an episode's going to be like. I personally have felt that this is a really important episode and a really powerful episode. I'm so grateful because you traveled 2.5 hours to be here as well. I always say that if someone's come a long way, because people don't realize the amount of effort that goes into just doing one of these podcasts. I don't do them online because the energy is never the same.
No, and I love doing it in person. It's so much better.
It's so much better. And I'm so appreciative that people are, first of all, willing to come all this way to come on. And to be willing to be vulnerable and to give so much in relatively short period of time, and I'm really grateful that our paths have crossed, and I would love to work with you actually.
I know,
and cross paths professionally, because I think there's
I knew when you rang me, I was like, this woman gets it.
Yeah.
I think there is people that get it and that are that kind of that way thinking and just are naturally more curious, or just I feel like when I meet somebody, like I can very quickly know if
there's a power there.
Yeah, like there's something, like a good energy there. That's just kind of the way I interact with people in general. Like I think it's really powerful. But yeah, I felt like that too. Like when we spoke on the phone.
Yeah.
Because I don't think I would have agreed to come on if I'd have thought, are you just going to want to talk about how we get kids to sleep? Because that you're going to be very disappointed.
There would have been virtually nothing in that.
No.
Because we could talk about that and repeat the same old, know. But this is, and
we have talked about, this is how we get children to sleep. But I didn't know what kind of wavelength, like what angle, that's important.
Yes,
that somebody's willing to listen to what I've got to say.
And the episodes on the whole, you could, like I say, you can never know, but the idea is that we connect through the stories, but the stories are always full of information that other people just don't know.
No.
And I don't think of myself as a straight down the line therapist. I am a little bit of a rebel, to be honest. And I like to disrupt the flow of what other people have been introduced to, because for their own benefit.
Exactly.
It's got nothing to do with me. It's for them. And then at least the information's there and they can do with that what they like. That information is the most powerful thing that we can have. If you don't have the information, you don't know.
Exactly. And I say to people that feel like they've made the wrong decision about parenting or you will only ever do the best with the information that you have. So don't punish yourself and don't feel guilty is a wasted emotion in that sense, because you did what you thought you should have done.
Yes.
All I'm doing is giving you extra information and a different angle that actually does make a lot of sense.
Yeah, so much sense.
Yeah.
It's so powerful.
And it's really good to see parents go through the process. And I think at first some people are a bit like, okay, I don't really know how this is going to go. And then 4 days in, they're like, how? Everybody needs to know that the only thing we've done here is change a bottle teat and stopped him taking in air, or all we've done is done some oral play exercises, or take them to an osteo, or change the milk from hydrolyzed to amino acid because they're struggling with dairy. Like sometimes it's that simple.
And yet the information, and I always say this actually about what I do as well. I'll give a lot of information, talk a lot about the brain, but then I say to them, look, I know this sounds complicated, but the methods that we use are actually really simple. But I like to give you the information so that if I do decide to use EMDR with someone, they understand what is going to happen and how it's going to
come to that decision.
Yeah. And again, with clinical hypnotherapy, this person, like you were saying there about being in constant fight flight, there may be nothing more than just the deep need for some really hardcore relaxation,
Yeah.
which can be a reset button.
Need that in my life.
Yeah. I mean, again, like you, I look at all the angles and I'm just like,
Yeah,
dip.
you're unpicking. Yeah, I can see it. You're like, I know what'll help.
It is simple, but it's also giving yourself permission to go
Yes.
down that road.
Yeah.
But I mean, hallelujah, praise the Lord. I'm getting religious now. I'm not actually religious, but that for you coming here today and
Aw.
sharing it with this audience and beyond, actually, because I hope there's a lot of shares from it.
Yeah, thank you.
Thank
Thanks
you
for
so
having
much.
me.
And please seek her out. Please support her, because what she's doing is massively important.
Thank you.
And we will see you hopefully again in some way, because I've got some ideas I want to chat through with you at the
exciting.
end. Thank you, Emily.
No problem. Thank you.